Yeah, good afternoon, everyone, and welcome to our monthly HealthTech talks. Now, for those who have been following it for more than a year, we usually discuss technology, AI, ML, and all those, and we discuss HealthTech startups and HealthTech. But we have so far missed out a very important part when you talk of health tech or health. It is mental health, and mental health in 2019 it was a very important issue which we have probably downplayed. But I'd say in the last 2 years it has become even more important. So to discuss, the post-pandemic mental health challenges and maybe towards the end what technology can do with it, we thought we'll have this panel discussion. So we have come out with a very, eclectic and diverse panel to discuss this issue, and I'll introduce them one by one. So we have with us Dr. Roshan Jain, Senior Consultant Psychiatrist and De-Addiction Specialist at Apollo Hospitals, Bangalore. Welcome, Dr. Jain.
Thank you so much.
Yeah. And we have with us Dr. Veena Tripathi, Corporate Trainer, Professor at Jaipuria Institute of Management. Welcome, Dr. Veena.
Thank you, Sunil. It's my privilege to share the panel with such experts. Thank you.
Yeah. And we also have with us Dr. Priyanka Tiwari, Assistant Professor, School of Education, Rishi Wood University. Welcome, Dr. Priyanka.
Thank you, sir.
So I'll just get straight to it. First of all, what was the Indian mental health scene in 2019? What do you think was the mental health situation? I know it's very difficult to talk of India as a whole. And has it become much worse after the pandemic? Since I guess the pandemic is over, we can now look at the last 2 years. So if you could start with these two things.
Who's answering? Anybody can make a start?
Yes.
Dr. Jain, you can start.
I think mental health has been always a very important part, and pre-pandemic, the worldwide data for mental health issues, depending on the conditions, anxiety or depression, were anywhere between 5 and 10%. Depending on if it's anxiety is little more, depression was little less. World over, we knew from WHO data that in developing countries, some of the mental health issues were much more prominent, but also less attended to. The treatment gap from number of people suffering from mental health problems, treatment available, but not taking treatment. Or in terms of, when we had the expertise and understanding of treating mental health issues, about 78% of people were not receiving some or no treatment at all for mental health issues. The stigma was very high in 2019. Over the years, the stigma has come down with education and with concerted effort from organizations. Pandemic has been a curse for our physical health and mental health, but it has also been a blessing for people to take account of mental health issues and to start to consider treatment for mental health. So what somebody suffered from for months and years before they take treatment now started to come forward within a matter of weeks and months, which was a seismic shift in the Indian context. In the UK and other countries where I've worked, the people taking treatment within 2-3 weeks of having emotional issues. And here we got anxiety and panic attack where people are suffering for a year before they seek help. Almost as if people think that suffering is in their destiny. And we always tell them that the suffering is not in your destiny, it's in your hands. If you're going to do nothing about it, not in your lines in your hand, but in your hands, if you do nothing about the suffering, then you is going to suffer. I don't think anybody needs to suffer even one extra day from any health issues, let alone mental health issues. So pandemic has changed a lot. The pandemic WHO data suggested there's at least 25% of people suffered from severe mental health problems. British Lung Foundation gave an idea to us that 30% of people who developed COVID had mental health issues. Indian Psychiatric Society, at the very initial stage of pandemic, say that at least 20-25% of people had severe diagnosable and treatable mental health issues. And those are the only people where we're seeing are the people who are seeking help. I think about half the Indian population, let alone the world population, suffered from diagnosable and treatable mental health issues. So my estimation would be at least 50%, which is nearly 70 crore of the Indian people, which is far, far more than any infections, any COVID-related problems. and yet we weren't giving enough importance. Now we know half the population has suffered from psychological problems, anxiety, depression. Now we know that we need to take action, and we have taken action. And panel discussion like this is another move in that right direction.
So that's huge. That's huge. So I'll just maybe the magnitude of that can be taken forward by the other panelists.
Yes, Dr. Roshan has put up really interesting and very accurate facts. Along with it, if we talk on experiential level, before COVID, 2019, we were all living very normal lives, pretty much automated, unrealized in terms of mental health concerns, right? So anxiety, depression, there is interesting data on how many of us suffer from it from the normal society also, but for us and for most of us actually it has been something. Okay, anxiety is there, but I am okay, I don't think I have anxiety. Probably somebody can have, somebody suffering from something. Mental health issues have been a very distant thing for people. They didn't realize that they themselves or people around them could be suffering from something. Also, that mental health is a thing. We understand physical health, we understand economical requirements, but realizing mental health as an integral part of your everyday life, I think, as far as I have noticed or pretty much observed or have read the data, people were not so very well aware about it. They had a regular life where somebody could be mentally sick, but that's not me. I am totally okay. I think that is a very interesting insight which came after COVID, after 2019, that mental health issues are real. The most perfect looking person, healthy looking person, physically healthy looking person can have it. In fact, all of us throughout our lifespan, somewhere or other, experience some anxiety, depression, or different range of issues. So it's not a foreign thing. It's very much a part of us. Mental health is as real. I think that is an insight which came after 2019, once we were, shocked out of our mental, automated, unrecognized mental health life.
I think we are very binary in our thinking around mental health. We think of people as being either well or ill. I completely agree to what Priyanka had said. We are more focused on physical health. Often we sweep in the rug when it comes to mental health. And as Dr. Roshan had rightly mentioned, such a huge number data. I mean, that's so. I'm so surprised. But India is having, apart from this, a very valid socio-economic and our own personal reason also to understand the mental health. One of an interesting data I found that according to WHO, they estimated that India's economic loss would be more than $1 trillion by 2030 because of the prevalence of mental health. And all this calculation happened before COVID-19. So now the current data, as Priyanka is saying, it might be little harsher. So I see basically three major aspects in mental health. We are having all the data, like one in every four of us. If you ask anyone, we know this, that one in every four of us have a mental health issue in a lifetime. So probably it would be more than 300 million people suffering from mental health. So the problem is large. And second, which I see, that there is huge shortfalls of professionals and service infrastructure in India. In fact, post COVID-19, there people have started revamping and refurbishing this service infrastructure, but the narrative is still there that we are having low service infrastructure. So it means we need to renovate this, and it is certainly important. But I don't believe that it's the only solution, and we cannot solve this mental health problem by only refurbishing the service care and wait for that to happen and allowing problem to become more big. So third challenge, which I agree to Dr. Roshan, that to change the social structure, the social environment where there would be more empathy, people will understand their emotion, there would be more inclusivity. So we need to change the perspective around mental health. That is a very big challenge post COVID-19. And recently, India has ranked 136 out of 149 countries in the list of UN World Happiness Report. So you can see that where India is lacking, 136. I mean, that's a rank which we have received. So and this rank we have received focuses on the effect of COVID-19 and how people all over the world have fared. So definitely India needs to focus more on this mental health, because when it comes to training, we train and taught from age 2 to our children, and we all have been trained that we have a body that needs to be nurtured, monitored on a daily basis. So much care on physical health. So we need to be taking mental health to the same attitude. That's
So, I
what my.
mean, yeah. So, I mean, yeah, it's a huge magnitude of a problem, and it's not binary. And also, like, we have to, there has been increase in awareness. But, one thing you mentioned is social change, the social structure. Now, I can't help but mentioning in this aspect social media. Like, we are cyber media, we are India's oldest tech media house. This panel discussion is under the banner of PCQuest magazine, which talks of technology. And the feedback we keep from everyone is social media, social media, social media. So, how much has social media made a big difference to mental health? In fact, somehow you have, the biggest haters is of TikTok. TikTok is supposed to have really ruined the, mental health of children. So, maybe if you could give your views on general social media and mental health in general.
Very interesting question, Sunilji. Yes, Roshanji, please carry on.
Yeah, after you.
Okay, Dr. Veena, you can continue. Yeah.
Yeah. See, I have seen this interesting data, and technology. When it comes to technology, we are currently facing epidemic, and the data is on the prevalence of mental health. We are facing epidemic. From COVID pandemic, we have shifted to epidemic condition, and with the rise of technological age, we lost true connection. That's what my take is. Touch, talk, hearing, smelling, watching, all these six senses are entirely lost. We lost our even ability to go outside even for groceries. And thanks to all these social media tools, if I am having any trouble, I have to just, this click and the thing is available. We can order everything online. Social media is there. You have mentioned TikTok. Everything is there. In fact, an interesting data. I mean, not in data. If a child cries, you just handle an iPad. But that's a significant change. That's the technological change. As when you see the levels of depression, suicide, and the rise in different diagnosis. Though I also believe that it's easy to blame technology as a causal effect, because research shows that younger people in this era born into this world of hyper capitalism, and thanks to this technology, where we invite this idea that we should be more contented, we should consume, we should achieve whatever to prove our value. So there are various things, but when it comes to especially countries like India, which can not only rely on revamping the service infrastructure, we need technology to be able to help us to innovate and to come up with solutions which disrupt the way we are looking at addressing the problems. I believe that Dr. Roshan can give a little more light on this, because in the last 2-3 years, they have seen a slight spurt in kind of teleconsulting or counseling that has been happening over the internet, and a lot of people have become more comfortable with that, which is very good, because now professionals are accessible to you. From that perspective has increased a lot. People are happier in having their privacy, and now they are having a professional at home. So social media is definitely helping, but we are lacking this societal struggle. So there is a catastrophic impact on mental health due to technology also. We cannot ignore that fact. So much question is that we get so much obsessed with the phones, whether we lost connection or it's symptoms of disconnection. It's a societal struggle, I believe.
I think, yeah, thank you so much, Veena.
Yeah.
And technology is here to stay, and everybody is using technology and consuming a lot more data that we can digest, and that is becoming a problem. Now, before the pandemic, there was worldwide data that people were using at least the small and medium devices like phone and computer for at least 8 to 10 hours a day. That was a bit of work, and then other social media and so on. So 6-7 hours of social media, other 3-4 hours of other work on computer. Post pandemic, the small, medium, and large screens, I call them. The small is a phone, medium is a computer, large is a TV. The consumption went up to 12 to 15 hours. Now there are enough data to suggest that we were spending nearly 50 to 60% of our time on these devices. So what is going to be the consequence of such high level of usage? We're going to get socially de-skilled. So the real life skills that are required for interaction, for communication, and other things are going to be taken away from us. We might become good at swipe and text and type and communicating with everybody around us, but we will have great difficulties in communicating one or two people right in front of us. And the rise in social anxiety is precisely the consequence of that. That you can type and text in a group of 200 people, but you can't talk in front of two people. And that de-skilling is a big problem. You can do online presentations on a PPT, but you put five people in an office, that you start to sweat and make mistakes and so on. Why? Because you're simply de-skilled and underconfident that you can't do it. Your real life skills are robbed away by the virtual life skills. And that shift we need to bring about, and that balance we need to bring about, where we say that the technology needs to be used mindfully. And we need to use it for various purposes, not for consuming the right amount of information and data, for consuming the right amount of news and material that we need to have, and for connecting with people who are far, not for connecting with people who are in another room. Technology is not for that. Husband messaging his wife on a WhatsApp when they are in separate rooms is not an appropriate use of technology. So healthy use of technology and mindful use of technology is what is required, because technology has given us a lot of advantages during the pandemic. For example, when during the catastrophe like the pandemic, people come to each other's help. Their solidarity increases, support increases. But this pandemic, which is infective in nature, that was taken away from us. We had to separate people during times of distress and crisis, and that skill, that human nature, was actually robbed away from us. Technology came to our support when that happened. We stayed connected with each other. We stayed in contact. Those in isolation or in ICU, we started to have therapy and consultation online. With the Niti Aayog and Ministry of Health and Family Welfare legalized video consultation very quickly in March 2020. After that, I think nearly every practitioner, mental health or other practitioners, have registered online to provide online consultation. That is huge. And we had a huge number of specialists, psychiatrists, for example, psychologists, counselors, everybody started doing online counseling. So you could now get support from the comfort of your room, from comfort of your space, and the convenience of your own time, that you could sit and consult and get guidance from anywhere in the world. That is what technology has done to us. And that shift came about because of the pandemic. Very rapid shift in government's mindset, making Niti Aayog I had people on the panel who were on Niti Aayog and so on, and talking with the mental faculty. Within 3 days, the government had meetings and approved the validity of online consultations. It was already valid by American Psychiatric Society. American Medical Association had said online consultations are legal and valid way of providing consultation at least 2 to 3 years before the pandemic. But we took the pandemic for us to change. So technology is good, balance is required, and consumption of content and data also needs to become mindful. People consume all kind of nonsense, but when you tell them to read up on that, you have anxiety disorder or panic disorder, go and read up on it, they don't. That is what it's doing to us. We are consuming everything that is not required and not consuming what is required.
Uh, Hello. So we had really very valid points being put up by Dr. Roshan and Dr. Veena. How mindfulness plays a role, trust me, we hardly realize in our everyday life. So one of the very basic things, I would just try to highlight the basic underlying problems, some of which are connected to our usage of technology. We designed technology, you know. So technology has been a tool and instrument for us. The problem happened because there were multiple reasons, some of which is it started to pose an contradictional during COVID. It started to pose a contradictory role in terms of the basic evolution that we humans had. We have been social by nature. We need humans for interaction. So one of the crisis point came in terms of technology usage is where we tried to substitute it, because now since ancient times we have been wired, we have been designed mentally in a way where we need human interaction. So it is posing a challenge at that level. Secondly, human is a very curious species, right? We are curious, we are awed by so many things, and technology gave us a very easy shortcut. There are so many very personal questions that we have, emotional questions that we have, and technology is a very one click help that we have. So probably these two things, no? The evolutionary threat to the social nature of us, along with playing a little negatively with the curiosity, has posed a threat. The third thing which I realized, through my journey is technology came to us. It was not always there with us. So there will definitely be certain generations who would be excessively curious and experimental with technology, because we are exploring it more and more. Just before COVID, most of the elderlies, at least in India, were not so very familiar with YouTube, WhatsApp, FaceTime. But currently, if you see, there would be most of the elderlies who would connect with their own family members through that. So this is another change which came. So there would be, I feel, in the process of evolution, there would be certain generations who will be excessively engrossed in experimenting and being inquisitive about the technology usage. Right. So here again, so I would totally connect with Dr. Roshan. We have to be mindful. Actually, technology is a tool. It's an instrument. It's nothing devil. It's nothing bad, or it's no angel. It's how you start to make it. So being mindful of how you use it, what you spend time on, how constructively you use your time on social media or utility of whatever platform you are surfing, that would be the key. And definitely one more thing which would really play a role is teaching more and more social compassion and skills of interaction. I think we are having a lot many things to talk with each other, but through the changes in the society that we have been experiencing, from a totally agrarian economy to a developing and technological society that we have become, social interaction, how to talk, empathy, these are some of the things which probably we need to inculcate in our basic curriculum also, and our everyday life practices. So this is what I have been observing through this technological aspect of our life.
Actually, I'm hearing a lot of solutions, hope, optimism, changes that have taken place in COVID. But playing the devil's advocate a bit, are we actually in a point of no return? Because I tell you, if you look at the last few 100 years, you look at, say, the industrialized revolution, people talk, but at least you would shut the factory and go home. Again, when the desktop era came, such things were issued, but still you shut the desktop, and even in your home, then even when the laptop came, you would take it to the bed, but you would put it on the side. But this is the first time we have a device which is part of us. It is our extension. It is there with us 24 hours. We sleep with it, and it is transmitting data even while we are sleeping. And in fact, people are talking of embedding chips into your thing, and something called the singularity, which US billionaires where we'll merge with AI. So I mean, it's all very well to say, but we are on a roller coaster ride. We are in a point of no return. As a cynic, I don't see any way out. We are going to go till the end. So what are your views on that? Is it a reality? Can we counter it? You know?
I think we don't need to make a return at all. I think we just need to move forward. Evolution is inevitable, and progress is a very loose word. So I don't like that. But evolution, learning, and growth is inevitable part of our life, whether it's artificial intelligence or technology and so on. As long as we use it to purpose, we consume it to requirement, and we make it a part of an extension of ourselves, as you said, but to our advantage, not to our disadvantage. Now, if you're going to have kids who are playing 15 hours of video game, online multiplayer games with other players worldwide for 15 hours a day, your university life is going to be wrecked. And those are the kind of consultations that we are coming forward with all the time. There are people of mine who've been thrown out of Singapore University, from New York University, and so on, because either they never went to university, or they did but could never cope up, and they was just completely consumed by their online activity, gaming being one of them, social media and other things, reels, YouTube channels. There are people who play video game on YouTube and have 200, 500,000, 1 million followers. These are guys who just playing video game. They don't talk about anything. He's playing video game and other people are watching them play for hours and hours. That kind of mindless use of technology and social media and the World Wide Web is going to cause us problems. And for those people, it might seem the point of no return. But for everybody else, every aspect, I tell people sometimes jokingly that if you have a phone in your pocket which is worth a lakh of a rupee, then there has to be at least 40 uses to that phone. Otherwise, you don't need a lakh rupee phone. 10,000 rupees or 5,000 rupee phone is more than sufficient. If you're going to waste your time watching YouTube video for 8-10 hours a day, then you don't need an expensive phone. But if you have an expensive phone, then it has to be used over 40 odd uses for consultation, for your for all your work, for your connections, for opportunities, for exploration, for growth, and so on, for reading. And you need to do a variety of things in a day. If you're going to, even when you do the screen time checks, it tells you exactly where you've been spending all the time. So sometimes when I look at my screen time and say social media was 1.5 2 hours in a day, it's depressing to say, my God, this is not right. But when I see productivity and reading and so on is gone on for over an hour or an hour and a half in a day, then I feel good. And that's what we need to bring about, an awareness of what we do, and making subtle changes, because you can't make overnight changes. Parents come and say, my son uses phone for 10 hours a day. Can you make him not use the phone at all? So as we progress in the wrong path, when we take a U-turn, it takes time to come all the way back. You can't just jump and come back.
I completely agree. I mean, if you will see, we have evolved over a period of time, over millions of years. The human brain size has increased as compared to our great predecessors. So rightly you said, in fact, it increases so much use of technology, increases anxiety, but eventually technology is also trying to help its own way. Like some of apps have been introduced in couple of years, from last couple of years, like screen time. You can check the
Yeah.
screen time of the kids. So the technology is also trying to help to solve the problem which has been raised by technology itself. See, we have evolved culturally. Certain skills are important, and so beautifully quoted by Dr. Roshan and Dr. Priyanka that mindfulness is important. So when it comes to kids, often at this age, at the older people they are false prey to depression and anxiety, and the younger people are, if they are going towards suicide
Yeah.
and having this anxiety feeling because of technology, then it's definitely very harmful. So we have to mindfully, we have to be a little cautious while using technology, and definitely technology is helping also that how to use it safely. There are certain apps who are contradictory that you should not use after this much hours, so automatically the alarms will blink. So their technology is also trying to help, but we have so much engrossed into the wrong side that we haven't used the right side of technology. So technology is trying to put it in the both of the way that the partial effect is not only the negative one, the positive effects are there. And COVID has given a wonderful, time where all the medicines we have seen, I mean, doctors can give a better view on that, how beautifully we were able to understand the medicines, the structure. As an engineer, I've seen so much manufacturing, and so much products have been beautifully evolved after this technology interventions. But how, as individual is using it, that's a little contradictory. So we have to. There are certain apps which can help in this.
Yes, this is very true. I would like to just draw the attention to a different perspective. Are we asking the right question? Because as Dr. Roshan said, technology is here to stay. He said it for the last question. Technology is here to stay. And of course, we have to come to a point where we need technology. So it is a requirement for us now. So often we focus how not to use technology much, how not to spend time much on media. So is it the right question, or how to make our general life interesting and motivating enough so that we automatically are not so drawn to social media, or maybe not so drawn to technology? See, I believe in the dynamicity and capacities of we human. If we have no human, we'll get stuck to technology and we can live, for days and months. That also means if we get proper human substitutes, the social substitute, the engagement related things, probably usage of technology will not be that big an issue, because technology in itself is no devil. As I stated earlier also, it's no devil. Of course, it has helped us in communication, in marketing, in management, in education. Name any field, there is a role of technology to be played into it. So it's inevitable, inseparable in our life now. So the point is moving next to it, how to use it in appropriate ways. And also, since it is very new and we are exploring every new field of it, new dimension of it every day, so curiosity is going to play a role. So I think our focus has to shift from how to stop using technology. From this, we have to shift towards how to make our everyday life more engaging, more productive, and more meaningful in terms of human relationships. So I think we need to upgrade our skills in social situations, in family situations, in basic relationships. The relationship with self comes, of course, at the priority. So I think these dimensions, once we start to work upon, the usage of technology is bound to get balanced. Because you can see those kids, who were just spending hours on Instagram, once they get onto field for playing cricket or for playing badminton, automatically the phone goes into pocket, even if for a while. So can we actually engage some meaningful activities where kids, especially kids, get more oriented towards the human interactions? I think that is one question we can really address. And as far as how to balance it is required, uh, see, after COVID, anxiety, depression, loneliness, social withdrawal, many of us experience post traumatic stress also. So, there have been severe mental health impacts of COVID, where again technology was a very good support, right? There are apps for anxiety, there are apps for sleep, there are apps for doctor consultation, of course, WhatsApp and Facebook, and video calls that kept us all connected in during COVID. So I think technology has said, okay, I'm doing good, I'm working my part. It's us who have to focus on other parts, and probably as engineers, as doctors, as educators, how can we orient the students and our family members back to social life? I think at even individual levels and at the level of structure and system, we have to play the role of improving the different aspects of life.
So actually, I like this phase of the discussion, and I maybe like to carry it forward and look at it in more in depth. So, what are the one or two tech solutions that you have seen that actually help and will be good advice for our listeners? As you said, technology can help and it can ease our mental health burden. There's so many tools, so many apps. You talked of teleconsultant, even AI can detect mental health. wearables. And also an advantage of this is like one of the panelists talked of a shortfall, low service infrastructure. Now technology can be scaled up. So maybe what you have seen, one or two tech solutions, it could be anything. It could be apps, telecons. Maybe if you can just dig deep and tell a few tech solutions which could actually be good advice for our listeners.
We'll start with Priyanka.
Okay.
Okay,
So,
Priyanka, you can start.
thank you for this. So one of the very basic thing which helped and worked. See, mobile is a great technology, and I've been working for Women Helpline, Women Power Line, which is official of government. So we had amazing calls for domestic abuse. Amazing in the terms of sometimes for a moment it was very scary also. And I had friends who have worked for child helpline, and in the first week there was first 2 3 weeks, the cases of reporting child abuse were doubled and tripled. So one of the sad facts was that it had really increased. But one of the things which really gave me hope was people were reporting. They had somebody to go to, even if they were stuck in the four walls. Police was really active. So communication was one of the real boon that we had. Along with it, the people that I was talking to, because being from psychology and also being an empathetic person, it's very obvious to start helping and suggesting people. So there were so many apps related to sleep, like Visa and all, where people really, it's totally AI governed. Sometimes you can really feeling, and you'll be getting such automated responses but so humanly responses that for a while you'll be taken aback. Okay, is it like really talking to us? So I have had those feedbacks from people. So related to that, for anxiety, and then there are apps like 21 days which keep on giving you basic very basic challenges for 21 days, because it's generally said, and some of the papers are also there, that in 21 days you can basically groom up some habits. A habit can start to form. So, like decluttering your mind, working on kindness, working on, self confidence. So, there are apps and things which are motivating people for that. So, right from anxiety to social loneliness, there are apps which are working for social support also, and of course, medical consultations, psychological consultations through video calls as on WhatsApp, Facebook, FaceTime. It was very much there. Apart from it, we have all had so many webinars during this COVID only, upgrading each other's skill. So I think that way also the different platforms, be it Zoom, Google Meet, they also played lots of role. So very honestly, technology was a very big help. uh, of course, it had the second aspect also. People got so glued to it that it's very tough to separate them now. And if they are being separated, there is withdrawal syndrome, there is, lot of depression. So, currently, since the question was regarding the benefits of it, so I think there are, plethora of apps which are actually helpful. But again, how do we use it? How much do we use it? And are we really trying to substitute it with the human interactions? I think these aspects would actually bring up the real utility of technology.
I completely agree to this word. Substitute is the biggest challenge. I mean, whether we are actually just using it for the safe, like there is Fitbit app, there are certain apps, we are having in our phone. Doctors on demand is the most interesting one. So, I mean, whenever I've seen, in fact, this doctors on demand app is even working in rural area also. That's a good thing. So technology is interestingly working. AI has started working. In fact, now there was one campaign which was, I think, driven by Mumbai police: honk more and wait more. So you will honk more, and that interesting. So if that there would be more honking, it will increase the decibel. So automatically the waiting time will get increased. So technology is actually helping us and for the sustainability, for the environmental also. But I so much agree to Priyanka how we are consuming it. Is it a substitute? Definitely, we should not use it as a substitute. It's there to help, not to become the part, not to. It's not a part of any human. It's definitely a part to connect to someone, but it's not the real connection. So uh, certain apps are definitely there. I think the whole panelists are completely agree to the advantages which technology has given to us. A plethora of advantages of technology. So many apps are available: Fitbit, Doctor and Demand. As a mother, I'm so happy when there is a screen time app. So so that screen server is on, and then the child automatically cannot use the mobile phone after 1 hour, so the screen is locked. So there are certain apps which are available, but again the substitute word could be something which I'll take from you, Priyanka, and that's something very important. How we are consuming the technology, because I have seen, and probably we all have seen, it has become such an important part in our life that if a child is crying, we as a parent, we automatically hand over the technology, a mobile phone in the child's hand. So again, the thing is, we are not empathizing with the child. We are not even sympathizing with the child. Forget about the empathy word. So we are just handing them a technology. And later, after 15, 16 years, when we will find that there are certain mental disorders. Trust me, giving that mobile phone could also be one of the reason, because you are handling a mobile phone to a 2-year-old child or 6-year-old child. So there are advantages, but disadvantages are little huge, because as a human, we are more interested towards people who speak to us more, and thanks to this nuclear family, we have inclined automatically towards more technology. Now we are not staying more in joint family. So nuclear family has automatically involved us that there should be because we human needs connection, as Priyanka had said. We need connection. So this technology has there to help us, but we are trying to replace it with the humans. Then there would be a trouble.
I think Dr. Priyanka and Dr. Veena has covered many of the points, but I think we have technology for health, we have technology for wellness and well-being, we have technology for convenience, and we have apps for all of these things. And from health point of view, I think people are consulting more and more online because with multifaceted personalities, with multiple roles that we have these days, especially women who have to do a lot more than men in terms of, with domestic responsibilities, with work in office or work from home, with so on. They are much more available to do these things because of technology. And it is very important that they are able to seek help from wherever they are, from whatever they are doing, whether be it office, be it work, be it outside. So the health apps are far many. Apollo 24/7 app is doing extremely well. I'm consulting several people on that app, but I'm consulting on few other teleconsultation, telepsychiatry apps as well, where I have patients in Sikkim to Bihar to Odisha to. And just today I saw people who came to see me here, and many of the migrants would be going back, not worrying about who to consult, how to get a prescription, what to get right advice, and all of them, whether or not they're well educated, they're all very keen to adapt to technology and seek help. Imagine somebody sitting in a, on a little farm in Bihar is getting advice and treatment and therapy for the grandmother, for their father and uncle, without a day of suffering. That is what technology is doing to us. So for me, health app is a real big change. And with the health app, we have other wellness apps. Insight Timer is a Calm app, and Headspace are the kind of apps that we tell people to learn to meditate, to learn to relax, to sleep well properly, to sleep in a calmful manner, to learn new things that we haven't learned. We don't need now a guru in person to tell us and teach us and guide us. We have a technology, provided we use it properly. And then we have convenience apps where we sit in our chairs and order on a Zepto. Even a packet of chips will be brought to us. And in India, we're getting really spoiled. A coconut will be dropped to you within 10 minutes of ordering. So convenience apps are very good, provided, as Veena and as Priyanka said, that provided they are a substitute, not a necessity, in the sense that you don't need to be spending all your time consuming Netflix and then sitting there and ordering all the junky food that comes to you in your chair, and then you complain of becoming obese and fat and lazy and feeling unwell. So the convenience apps also need to be used to your convenience, not at the risk of becoming dependent on it. You say that you haven't done all day, nothing you've done all day, not been out, not had a breath of fresh air, uh, and hope to start to feel better. That's not going to happen. Uh, so there has to be a balance, and the balance is always have to be in favor of physicality, physical exercise, movement, and activity. Uh, Technology should be our assistant. We should be the masters.
Right.
So anyway, that was very good last 10 minutes, because I'm sure our listeners will go with a lot of takeaways, and that will actually make a difference in their lives. So anyway, moving forward, I mean, one thing we cannot avoid discussing is the metaverse, because it's going to come one day. It may come in 5 years, 10 years, 15 years, and we'll all be using it. Some may end up living in it. So how is metaverse going to affect? Because it's like the moment we solve one problem, something big comes. So I'd like to hear your views on the metaverse.
Anybody can start. Veena will start this time, I think.
Yeah, metaverse technology, if I'm not wrong, you are asking about this, right?
Yeah, so basically the thing about the metaverse, why I'm asking is because, see, when you talk of technology, we are getting more and more immersive. Like,
Right.
like I said, it was the desktop, the laptop, and the mobile. Mobile is 24 hours. Now, what could be more than the mobile? Now, the thing about the metaverse is you will live in it. How you will live in it is, one is you could be wearing AR glasses. The problem is the metaverse is also aiming to be 24 hours. Like, you could be wearing a VR headset at your home, and in that VR headset, you could be watching movies, you could be educating, you could be doing tourism. Then there are
Right.
something called AR glasses. So even when you go out, on the other hand, there could be even a hologram around you. So the problem is that right now we have a 2D, two-dimensional virtual world. The tech people are creating a 3D dimensional world, and you may spend 1 hour, 2 hours in it. Some people may be tempted to spend their entire lives in this virtual world. So basically, when you talk about metaverse, it is metaverse, a virtual universe, a more immersive than even what TikTok is now. So that is what I mean is this virtual world is coming, and it's so how does it?
See, technology comes with a host of benefits. That's true. And when it comes to metaverse, I think it's an immersive experience through the use of digital selves or avatars, whatever the new technologies are using. So you have just said that we can think of metaverse as three dimensional, because now it has also, like internet was two dimensional, but metaverse comes as three dimensional things. So I think again that some one interesting app, not app, one interesting VR I found for the old people, and in fact, one of my student gave that interesting case study to me. So that VR had specifically designed for the older and senior people who are residing all alone. So that technology is that app was really helpful for the older people, and this was recently highlighted also in some uncovered social media documents. So if I'm not wrong, some video games release dopamines are also there to advance towards the goal of the game, such as moving into another level. But this dopamine, which has been released through the metaverse technology also, like you have to follow, you have to like, you have to comment, you have to subscribe. A lot of negative things are also again coming with metaverse technology, like cryptocurrency. All these things have been investing. It releases dopamine also every time you invest in metaverse technology. So that we cannot ignore that type of pleasure which brain needs. So when it comes to metaverse technology, I think that because I've seen a couple of people who have automatically immune towards such type of tools. They have taken this because that's a digital substitute. That's very interesting one, because it's a VR one. You are actually visually there with the tool. You are actually believing that you are there with the product, so it increases dopamine activity and certain more such things. So metaverse, when it comes to me, I believe that it's little not very harmful, but it little harmful when it comes to mental health, because it reaches directly to the third stage, because here there would be more reduction of human touch. The five senses will again would be more less. So that older people, couple of apps are very good, that for the older people it was very good when they got this VR tool. When they got this VR tool, they were able to see all the videos, all their wedding videos were there, and they actually believe that the kids can put the cassettes in that app, and if they are not physically be present there, they can attend such functions. So it was good, but in certain app, when it comes to, again, it depends from which segment we are targeting upon. If a child has been immune towards this metaverse technology, it is a little harmful. But if a people who has reached to a certain age, if a patient who is just stuck in the hospital, for them metaverse technology is a little helpful. So that's my take on this.
I think the metaverse is going to play a significant role. We have already taken a big leap in that direction. I think, as we were discussing earlier, I think there is no turning back. And it is an extension of virtual reality headsets that we are using, where it was almost one-sided, but metaverse will be two-sided. So it's more immersive. It's three-dimensional, as you can call it. It's more interactive, and it gives you the sense of presence in the situation, in the setting. So that takes virtual reality to the next level. And I think it's going to be very useful in especially in my specialty, where consultations and therapy, especially behavioral therapy for phobias and fears and obsessions and so on, is going to play a major role. When we do exposure therapy, we expose people to, for example, two-dimensional images of a dog. For example, if you're scared of a dog, and then you get comfortable with the image of a dog, and then next is that you show them a video of a dog, and then third, you bring a dog and make them sit at the end of the room, and then gradually the progression of working towards a feared element. With virtual reality, it takes it to the next level very quickly. So, and the person, both therapist and the doctor, patient don't have to be in the same environment, same country even, and you can still do the therapy almost in a feeling of real setting. So it is going to play a major role in behavioral therapies. It's going to play a major role in trauma-based work. It's going to play a major role in other form of exploratory psychotherapy, where you can use elements of technology to recreate certain elements, for example, to recreate certain environment or certain situations. So it's going to be groundbreaking in terms of not just doing things in a safe and secure environment. So knowing that I'm sitting here in the room and I'm not going to be, sinking in a pool, that can help me to overcome fear of water, for example, or fear of swimming. But as long as virtual reality then progresses into real world interaction in terms of therapy and treatment, then it'll act as an adjunct or a substitute for the work we do. So metaverse is also going to come with a lot of negative elements to our life. We don't need to find happiness and contentment in a virtual life that we could actually find in real life. And if we are willing to commit, as you said, Sunil said earlier, that we're going to be consumed, we're going to be using several hours. If you're committing 10, 12 hours to virtual reality, virtual life, metaverse, imagine committing that kind of time and energy to real life, to real relationships, to real things, tangible things that you want. Imagine the feat that you can achieve. And people never realize that. People think that that is entertainment, and that was entertainment, and it's now become compulsion and habit. And it has, you thought you were consuming technology, and only realize that the technology has consumed you, and that should not happen. And some of my colleagues were very, very excited when metaverse was launched by Facebook and so on. And I said, this is a real problem, because with the Facebook history, we know that they have no interest whatsoever in bringing technology to the use of people. They want to use people who use technology. So that is a big problem, and I don't know how we're going to manage that. But we need to progress in the right direction and progress properly. Each individual, I think, needs to decide how we're going to be using. When I was in college days, when the internet had come out, there was I think many people would have used it. There was a website called Second Life, which was very much like what the metaverse is they're talking about now. You could create persona. If anybody's been on Second Life, it was pretty boring. I used it for half an hour and I thought it was just rubbish. And you could create a persona, you can go shopping and you can do things. And you're just taking that to 10 years fast forward, and that's what metaverse is. So nothing great in terms of innovation, but useful in terms of health and other access to other technologies.
See, this has been a very constructive discussion because somehow we are all falling in the same line. AI is something, see, metaverse, at the base of metaverse is, of course, AI and technology. And we have to remember that AI is something which was designed on the analogy of human mind, by human minds, and for human minds, right? So when we have human minds at all the three dimensions of it, we definitely have the darker sides of human or the faulty sides of human decision making equally engrossed in this designing and its utility, its consumption. So the point is we have to be a little more realistic when designing things or inventing and consuming. Technology is something which is totally dependent on how do you use it. So as much as it has benefits, like sir said, for systematic desensitization, for progressive exposure to people, for behavioral therapy, and for explanation also, for educating people, of course there will be lots and lots of benefits of metaverse, but we have to be very realistic and open-eyed that we cannot totally escape the drawbacks it's gonna bring, right? So why? Because of course the designing part has human element, the consumption part also has the human element, and I take classes for psychology in media, and I would just quote one child while I was asking, why do you think media is connected to psychology, and how does it happen, and why do you think it's important? So one of the responses among the very beautiful answers that I have got, I'm just telling one problematic one. So I'm just telling the child, say, we have to earn money. It's not always going to be social service. So we have it very clear in our mind that media and its usage is a source of making money, right? So I think here, before we actually start totally celebrating metaverse, we have to be really, analytical and objective. Are we totally aware of what it is, what it can lead to, and how to regulate it? As product designer also, how are we going to regulate its usage and its functions? Before usage, the functions. So here I realized that actually being a little responsible at the level of creating the products, designing the products. Along with it, one of the things which will really, really be required is awareness, because psychoeducating people about things that media is just one aspect of your life. Metaverse, technology, it's just one aspect of your life. Please do not be totally engrossed and lost with it, because we know that human relationships are tough, social situations are tough. Even very one-to-one in the conversations are tougher at times. So this technology is also a very easy tool for mental escape for all of us. We are very frustrated, we go, we scroll. So metaverse will not have very different behavioral response from us when it evolves. It would be used for escape, it would be used for entertainment, it would be used for a lot of positive and dark desires that we possess. So I think here we have started with it. It is going to be a great component which would be contributing, but we really have to be very objective and analytical while dealing and designing things of metaverse. It is a double-edged sword.
So anyway, I think we're out of time, and it's been a very engrossing, enlightening, and enriching discussion. We had a lot of solutions, but maybe before we go, within 30 seconds, if the three of you can give, one big solution for mental health India. It could be a tech solution, non-tech solution introduced by the healthcare industry, the psychiatrists, or the government. Within 30 seconds, maybe I'd be interested. We can just round up this great discussion with that. And
Okay, so I think,
yeah.
See, one of the things that I would firstly suggest is to remember that you are human and the people around you are equally human, So please be accepting and expressive of your emotions. It's gonna be tough, but trust me, you can do it. Second, take care of your emotional health and physical health and spiritual health as well. It is going to be a big support. What you can do for it is, I'm just naming some of the techniques. You can study about it. It's journaling, it's grounding, it's deep breathing, it's mindfulness, it's progressive muscle relaxation, it's systematic desensitization. So these are some of the techniques which you can study more upon. Apart from it, please be empathetic about the people around you, and please be expressive of your own needs and requirements. Even if you find it silly, be open to communication. I think that's gonna really help you.
See, I believe mental health is not and cannot be the responsibility of an individual alone. We do live in a collective, and collective has to work together to improve mental health. Both tangible as well as intangible aspects of workplaces are very significant in promoting mental health. So, apart from whatever Dr. Priyanka have mentioned, some scientists have proved that little as 5 minutes a day doing something for our emotional or mental health, even it could be stretching, singing, speaking, some physical exercises. You have to find your own movement. Writing, if you are feeling very lazy, just do little shake. That also is something very important. So that little small step, we can come to our own solution. And empathy is something more important. We should try to become more emotional intelligent person. We should empathize first to ourselves. If none of the emotion can work, the best way which I use it, name it to tame it. Whenever I'm in struggles, I just name it, and I feel that, yeah, now my troubles are a little gone. So these are the certain tools which I use, and I believe that we all can be these all tools can be useful for all of us. Thank you.
I think balancing is very important. And for the future, balancing is all what we required. We used to talk about work-life balance. Now we need to talk about our own life balance. It's no longer just work and life. It's not dichotomous. It's multiple things we need to balance. And that balancing requires an acute awareness and a constant sense of harmonization, retuning yourself on a daily basis, on a weekly basis, on a monthly basis, to see which of what you're doing too much of and where you need to sort of put your foot down and reduce the consumption, reduce the intake. Uh, I think you need to start to balance between how much you use your life in virtual, real life to real life. And that is something that technology will not be able to help you with. So that is something that you have to do it yourself to reharmonize, to resync, to balance out your life. Uh, and if you're going to spend several hours on media and technology, I think you need to turn that around and spend those hours in your self-care, self-love. And self-love is nothing but what Priyanka and Veena has said, where you be consistent and disciplined with your health and wellness and fitness. You be consistent with what you consume in terms of food, but also now we have to worry about consumption of data and information. uh, we need to care for ourselves, and we need to care for our relationships, real relationships and networks, because they are the ones who will stand with us. Uh, you don't want them in the virtual air. You want them in real life. And self-love is above self-care. And if you love yourself, then you hate others so much less. And what the media does for you is that it brings a constant a sense of relativity, and that envy and that jealousy can turn into a lot of hatred for others and also hatred for yourself. So that can be counterproductive. So see what you consume, be mindful of it. Uh, for in the Indian setting, from the health setting, I think a very last point is that I think even an hour of suffering is unacceptable. We have technology at our hand. We have people across India and across the world to advise and guide and treat uh, at your doorstep. We have medicines that can be delivered, especially in India, within half an hour of most cities and tier 2, tier 3 cities. So when treatment is available to you, when advice is available to you, when medicine can be delivered to you, when therapy can be conducted for you, then what are you waiting for? You know, what is it that you're delaying it for? You know, so that is not acceptable. I think to me, even an hour of suffering is unacceptable, because and if that is happening, then we are the only one to blame for. So move forward, and post pandemic, use the technology for your principally for your own advantage, for your health advantage, for your family advantage. Everything else will follow.
So that positive and Acha, it's okay, Dr. Priyanka, you can
Just
add.
one very small point,
Sure,
and
sure.
while Dr. Roshan was saying something, it totally clicked me. One of the very basic thing and one of the best things you can do for yourself is please eat right, and take care of your nutrition, because your mind and body is connected. If you are starving yourself, or if you are overfeeding yourself, or you are wrongly feeding yourself, you are damaging. So please take care of what you
When
eat and how much do you eat. So thank you,
in
Dr.
my
Jalal. No, it really
when we
clicked me what you were saying.
when we consult patients, we always used to tell them that when you consume too much food, it causes obesity, and when you consume too much data, it causes anxiety.
Yes, yes.
So I think that's a great place to end this panel discussion, and it's been absolutely wonderful talking to all of you. Thank you so much.
Thank you.
Great. Thank
Thank
you.
you. Thank you.
Thank you so much.
Thank you, everyone.
Thank you. Thank you, everyone. Thank you.